we'll start with the veins. That's the blue, of course. And coming right out of the right atrium, we have, what is this here? The anterior vena cava. If you said superior vena cava, I wouldn't care. But in a cat, it's anterior. Coming off of that, going to the sternum, this is a vein, and that would be called the sternal vein, oddly enough. Okay, now here, it bifurcates, and at this point, each of these are the brachiocephalic veins. Okay, and going laterally, it bifurcates again, and this one is the external jugular, and this one becomes the subclavian. In the axillary area, this is the axillary vein. Then it becomes the brachial vein. One last time, it bifurcates, and when it goes to the elbow, on this side, this would be the ulnar vein, and this would be going on this side. This would be the radial. Okay. Did I miss anything? Okay, it's symmetrical on either side. It's the same thing. Did I have the internal jugular? I don't think we did. Okay, so we don't have to worry about that. Okay, so that's it for the veins. Now the arteries, a little different. Okay, you find the aortic arch. That's just right down here. And the first branch off of it is the brachiocephalic artery. You do not have to say right or left because there's only one there. It's just on the right. So let's follow that up, and it will almost immediately have a couple of branches on either side of the esophagus here, or the trachea, and that would be the carotids, the common carotids. Okay? We don't need internal and external, right? Nope, we don't. Okay, so go a little further. As soon as those carotids come off, then it becomes the subclavian. So the second one, let's see, this is the first one, this is the second one. Then right here, immediately it becomes the subclavian artery, but you'd have to say right. I don't take off for that, but you should get in the habit of right and left. Okay, and then in here, the axillary artery. You go a little further, brachial artery, and then it's a little harder to distinguish the ulnar. You can see an ulnar here, radial. It's a little harder to distinguish, but that would be going to the to this part of the lower or upper extremity. Okay, so that's a little different than the humans. But hi, Cassie. Gonna take this again? Okay.
She's gonna do it for me.
I can help anyone.
She could do it for me. She's very good. Okay, so what we'll do is remember that the one difference in the arterial of the upper cat is that both carotids come off on the right. In a human, the carotid comes off on the left, off of the subclavian. So that's the only difference there. Okay? So where are we now? So the second branch coming in this direction, the aortic arch, the second branch is now called the subclavian, and it would be the left subclavian. Okay? And the way I remember it is since the heart is on the left anyway, you don't have as far to go, so you don't need a combined brachiocephalic, because the body is very efficient as far as structures. They won't design a structure if they don't need one. So they combine it going to the right because it has further to go than on the left. That's the way I remember it. So this, the second one, and that's the only other one we need to know, is now the left subclavian. It comes all the way over to here before it becomes the axillary, then the brachial, and then again it'll bifurcate right at the end, and this would be the brachial artery, the radial artery, and this is the ulnar. Okay? I catch all of that, Colin?
Yeah, I actually missed it for the veins. You actually did ask for the
Oh, okay.
internal.
Okay, here is the internal jugular. It is oddly enough on the internal side. And this is the bigger one. This is the external jugular. Thanks. Okay. There you go. Anything else? No. Okay, so that's it for above the diaphragm. Below the diaphragm, you have, let's see. We'll start with the arteries this time. This is all the way from the diaphragm to the bifurcation down here. This is all abdominal aorta. Okay, all of it. Now the first branch off is called the celiac trunk, right here, and that will have 3 branches. One of them continues straight, this one right here, and that is going to the spleen, so they call that the splenic. Okay. Then they have one that goes straight to the stomach, and that's the gastric. You don't have to say right or left, just say gastric. Okay, and then there's one that dives deep, and that is a little harder to find, but I do find it sometimes, and that would go to the liver, and that's easy to identify even though it isn't on this one, and that would be the hepatic artery. Okay, so this is celiac trunk. The continuation of the celiac trunk is the splenic. The one that goes to the stomach is the gastric, and then there's one that dives deep, and that would be the hepatic. Okay. So the next branch right off of that is the superior mesenteric, and it goes, mesentery means intestine, so it goes to the intestines here. It supplies oxygen to the whole small intestine and the right part of the large intestine. Okay. So you go a little further down. Here's where the kidney should be. Okay, the next branch would be going just above the kidney to the adrenal glands. Now the adrenal glands are right in this area. They're kind of friable. They kind of fall apart after dissection, but it will not only supply blood and all that comes with the blood to the adrenal gland, but it'll go to the lumbar area. This is lumbar from here to here. So that's why they call it the adrenal lumbar artery. Okay? And it goes on both sides. That's it on this side here. Okay? The next one goes to the kidney, and they call that the renal artery. Okay? Then you go down a little further. And the next one we had to think about is going to the large intestine, at least the right or left side of the large intestine, and that is the inferior, or in a cat it would be posterior mesenteric artery. And what it'll do is it'll loop all the way up through here. You can see it all the way up on the inner edge of the large intestine. Last one, before you get to the bifurcation, you have the iliolumbar arteries, right and left, and they supply the lumbar area, but also the ilium. So that's why they call it iliolumbar. Okay, next is interesting structure. It's right here. The bifurcation in a cat is the different, that's how, the only difference in a cat as opposed to a human. It has, in the arteries, it has no common iliac. The ones on the external area, it would be a Y out here. That is, that right here and here, that's the external iliac artery, and these are the internal. Now, I should cut this one because this is just confusing. Okay, this, the internal Y would be the internal iliacs. You don't have to follow the internal iliacs. They just are too small, but you do need to know what happens with the external iliac. It does, in this area, right here, it becomes the femoral, and that's as far as you need to go there. Now there is, come to think of it, yeah, right here, this is right at the articulation here. This is the deep femoral. You can see a nice example of that right here. Okay? Now with the venous side of this, we have two sections. One that drains all of the structures of the used blood, so to speak, with the carbon dioxide in it. But you also have, as a venous system, one that parallels some of the arterial, but instead it takes blood from the intestine, liver, and the spleen, large intestine too. It'll take it directly to the liver. Did I say liver before? I'm sorry. It takes all of that, takes it to the liver, and that's a portal system. Remember, a portal system is the venous system, where our arterial system too, where you want to go directly from one area to some other area without going through the whole body, because that's useless. Okay, you want to get all of the nutrients that are just been broken down in the intestine and take it right to the liver, and that's called the portal system. And in this case, it would be a hepatic portal instead of the one in the pituitary and hypothalamus. Okay, so let's talk about that. So there won't be as many blue veins as there were arteries. Okay, so this is all vena cava, and then vena cava would be from the heart all the way down is called one thing. That would be just the posterior vena cava. The reason I say that is just for your information. The aorta, you have the arch, then you have the thoracic, then you have the abdominal. So it's a little different, especially they'll mention that in human more than in cat. Okay, so the first thing off of it is this branch right here, off of the vena cava, the posterior vena cava, is a lot bigger than all of these are a lot bigger than the arteries for some reason. And this would be going to this area here where the adrenal gland is and the lumbars. So it would be called the adrenal lumbar vein. Okay? That vein drains all of this. It's going in this direction, of course. The next one is the renal vein. It drains the kidney and that is dumped into the vena cava, the posterior vena cava. Now, there's one other interesting area here, is right here. This is the gonadal vein, and it should hook up right here. This one hooks up almost in the kidney, but normally it'll go right into here, only on the left. On the right, it comes directly to the vena cava, right in this area here. Okay, that's probably the nub of it right there. Okay, so on the right, gonadals go into the vena cava. On the left, it goes into the renal vein and then the vena cava. Now you come down here and you don't see anything blue until you get to just before the bifurcation, and that is, this drains the ilium and the lumbar area, so they call that the iliolumbar vein. It dumps right into there. Okay? Any questions yet? Okay, then you have the bifurcation. It's hard to really visualize this without hurting the dissection above it, but on either side here of this bifurcation, this is the common iliac. Common iliac vein. So let's look at it on this side. It will be common until the internal iliac right here, I don't know if you can see that, right here, comes off of it. Okay? So as soon as it comes off of it, now this is the internal iliac, and this will be the external iliac. Okay, the next area to remember is right at this articulation here. Now it becomes the femoral vein. And at that point, you have a branch diving deep. That is now the deep femoral vein. Now, these two veins get confused sometimes because they both dive deep. If it's the deep femoral, if it's near this joint. If it's up here, it is the internal iliac. Okay, those are the two. Okay, I think that is it for the veins, isn't it? Except for the portals. Okay, so now the portals are a little tougher, especially on this one, because some of this you just have to imagine. Let's see.
Nice.
Okay, right here, this is, you see this yellow here? Okay, you have to imagine it, but this goes all the way along here, and it parallels the artery. And if it's yellow and I point to it, or pin it rather, that would be the inferior, or in the cat, posterior mesenteric vein. Unfortunately, they don't call it portal vein. I would like them to do that, but it would differentiate it quite nicely. So this, anywhere along here, that would be the inferior portal vein. Now, the inferior portal vein in a cat dumps into the superior, or it would be anterior portal in a cat, anterior portal vein. Now, the anterior portal vein, these are all these yellow branches. They all coalesce right here into the anterior portal. So the inferior portal dumps into that anterior portal. It goes for a little bit until it runs into the, I was calling it portal. I shouldn't call it portal. But you know what, I'm just trying to differentiate it. Okay, so this is the inferior mesenteric. This is superior mesenteric. They come together. It's still called the superior mesenteric until the one coming from right here. This is good. Come from the spleen. Now, this is a good one. You can see this quite nicely. When that comes together, it is now called the hepatic portal vein. Now, it's hard to see here. Usually I'll show it on this side where it's going into the liver, right in here. But you could identify it here. You see, it's just harder to see on that side. Okay? So I would probably use this one. So much thicker. Okay, so that's the hard one. And this is a pretty good depiction overall. There's some deficiencies, like this one, the posterior mesenteric. You can't see that very well, but if you see this large intestine and something pinned here, and I ask about the portal system, you know what it was. Okay, I think that's it. Did I miss anything? Okay, I'll just keep going.